Opening procedures. Knock on the door. Greet and address the resident by name and title. Introduce yourself by name and title and explain the procedure. Ensure that the bedwells are locked and that the bed is in a low, safe position. Raise the head of bed to a high Fowler's position. Place the call light within the resident's reach. Provide privacy by closing the privacy curtain. Ask the resident about their preferences. Verbalize washing hands. Gather supplies. You will gather a total of 7 items, including the clean barrier. Place the clean barrier on the overbed table. You may use a Chuck's pad or a towel. Gather remaining supply items and organize them on the clean barrier on the overbed table. You will gather an emesis basin, a cup with water, toothbrush, toothpaste, 1 pair of gloves, and a clothing protector. You must use a cloth towel as the clothing protector. After organizing your supplies on the overbed table, fill the cup with water. Drape the clothing protector across the resident's chest before providing mouth care. Prepare your toothbrush by moistening it in the cup of water and applying a small amount of toothpaste to the bristles. Don clean gloves. Critical element step. Clean all surfaces of the resident's teeth, including the tongue, using gentle motions. Place the emesis basin to the resident's chin while the resident rinses their mouth. Wipe their mouth after each rinse. This is one of the most commonly omitted steps. Allow the resident to rinse their mouth as many times as necessary. Remove the clothing protector and appropriately dispose of it into the soiled linen hamper. This is another commonly omitted step. Replace supplies in the designated dirty area. Rinse the toothbrush. Empty the emesis basin, rinse it, and empty the rinse into the sink. Dry the emesis basin. Ensure that it is completely dry. Place the toothbrush in the emesis basin bristles up. Ensure that you maintain a clean technique with the placement of the toothbrush. Replace the emesis basin in the toothbrush back in storage. Remove and appropriately dispose of the clean barrier. If you used a Chuck's pad, dispose of it into the waste bin. If you used a towel, dispose of it into the soiled linen hamper. Remove gloves without contaminating yourself and immediately dispose of them. Immediately verbalize washing hands. Replace the overbed table. Closing procedures. Ask the resident if they want to maintain their head of bed in a high Fowler's position or if they'd like for it to be lowered. Ensure that the bed wheels are locked and that the bed is in a low safe position. Ensure that the call light remains within the resident's reach. Ask the resident if they want their privacy curtain to remain closed or open. Ask the resident about their preferences. Verbalize washing hands, skill complete.